So my name is Steve Lawson.
And my name is Anya Fofana.
Welcome to the live demo sessions for RSNA 2020. In this session, we're in the SIGNA Premier system, and we'd like to highlight the intelligently efficient technology that we're showing this RSNA. These live demo sessions will be held 2 times a day out of our headquarters here in Waukesha, Wisconsin, but we also have a session being led from our office out of Buc, France. So depending on where you are in the world, maybe that time will work best for you. So on this live demo session, we'd like to share with you the use of air touch and along with the coil.
That is why we have already our volunteer positioned here on the table, as you can see. He is laying in our 48-channel brain coil, which is also utilizing air technology. We have 48 elements in this coil, and it will be like all placed on his head. And then on top of the head coil, we will put our 30 elements A coil on the volunteer. Now that's going to show that also in the camera that you can see how large this coil is. It is 65 centimeters in total, and you can use it in any way you can think of, and you don't have to like think about any rules with this guy. So you can like turn it upside, sideways. You can wrap it around the patient's belly if you have a huge belly. You can wrap it around long bones, and you can like offer the patient now for spine imaging to find a position on the table he is comfortable with, and maybe place it even on the side of his back and scan the spine like that. So this coil is really used because as a technologist, you don't have to follow any rules anymore. You can just put it on the patient and scan it back. And that is what we are going to do now with him. We just want to put the air coil on top of him. And as you can see, I don't have to like use, even though I will scan the liver on him, I don't have to use any bellows or attach anything on him. I can just put the air coil on top of him, strap it down with my hands, and like form it as a blanket. So no need to have additional backwood clips on him. And then I just like close the head coil. So as Steve mentioned, we want to show you really the advantages of using air touch here. So that means for our landmarking, we don't have to like landmark a coil. We don't have to landmark anything else on the patient, only where we want to start the scanning with, and he selected to start the scan the brain with. So we just use our intelligence on the table, which is located on both sides of the table to do the landmark. And then all we have to do, push one button, the table moves in, and we can start our scanning session from outside. Okay, now we are here in front of our user interface, and as you can see, we've already launched the patients here, and I have filled out everything. I highlighted the protocol, and we will just start the exam. We will start in the brain, and then we can walk our way all the way through the body and ending up in the pelvis. And the first thing I want to highlight here is our new user interface for the coils. As you can see, we just have to select the coil itself. No need to select modes anymore or think about where we want to start it or deselect coils. So I just like go ahead and run a localizer with all selected coils, and the system will do the rest for me. The other thing which you will see and notice here before we start and run the 3-plan localizer is another intelligent feature in our 3D scanners. So we have an SAS Scout implemented. So whenever the scanner detects a head coil, it will run the calibration scan here. And we know exactly where the coils are on the patient. So we don't have to worry about deselecting coils or do anything. Oh, that's why. Okay, we just rerun it again. And as you can see, we saved the protocol in the wrong way. Maybe that's good also to highlight that on our scanner here, we can do each orientation. So we can do head first scanning, and even for the brain, we can do feet first scanning as well. So that's really nice. But today we position the volunteer obviously and feet first. So that is why we want to start. So now that is happening, what we just talked about. We are running automatically the Psi Localizer, and the system will detect really where is the patient in the bore, and how he is located in the bore in the coil. It does that automatically, and then we just run our 3-plane localizer directly after the Psi localizer has been done. And then we start with our first two sequences here, where we want to highlight another new feature on our platforms, which we call Air Recon DR. And I will talk about a little bit more of that in the detail. Just one thing I want to highlight here, when we run the 3-plane localizer, you see here a coil calibration is happening. So that is always the part where air touch really starts to kick in, because we are creating a sensitivity map. And the system will have all the channels turned on in these 2 seconds, and the coil elements in that field of view will provide their signal in these 2 seconds, and then the software will exactly know where the coils are on the patient and just select the coil needed for that scan. So that's really a huge advantage, because you don't have to worry about mode or have to think about which coil you have to use and where they are, because you know exactly that the system will do the job for you. So the 3-plane localizer is done, and we will start with our first T2 sequence, which will only be 44 seconds. So it will be 44 seconds because we use Air Recon DL to still provide good image quality with a decent, with a good implant resolution of 0.6 by 0.6, and we go through the entire brain with 4mm slices. We accelerated the scan with our acceleration techniques to come up with 45 seconds. And we use Air Recon DL, which is our deep learning, where we've trained the model to recognize noise in an MRI image and remove that. So the smart tool just knows exactly what in this image is noise, and will just remove based on the Recon DL strengths depicted here on the user interface, and makes it easy for you to have images in really fast scan times with no noise removed. And I want to repeat and show you the other way how to use and utilize Air Recon DL. So I will do exactly the same contrast, and I repeat that sequence by doing a scan with 3mm slice thicknesses through the entire brain. And I want to end up in a pixel size of 0.4 by 0.4. So here you see that I've picked a matrix from 640 by 512. And also here, I picked the recon strength high. So that means I'm going to remove, I think, around 75% of the noise out of the K-space. So these are kind of like 2 different ways how to use Air Recon DL. And the one way is we are using Air Recon DL to be fast. And in the second way, we are using Air Recon DL to have high resolution images. Okay.
I'd like to remind everyone throughout the session, if there's any questions, feel free to put those into the chat, and we'll look at those often and try to answer those as we go.
So then, because we talked about air touch, I want to show you how to go through the body with not worrying about coil elements on our scanner. So that is why I just run another localizer here through the cervical spine. Again, I don't have to change anything here on the user interface regarding my coil management. I can just let the system do the sensitivity map and understands where the coils are located on the patient, and then the system will pick accordingly. And in the meantime, while this is running, we can look at our first acquired images, and I want to show you the images with Air Recon DL, but also the images without Air Recon DL, so that you get an understanding of what Air Recon DL really helps us here to accomplish. So left-hand side are the images with Air Recon DL, and left-hand side without. So when I zoom in into these images and look at maybe tiny little structures, you can definitely see that the noise has been removed out of the images. So for sure, you can see why now we are capable of doing like fast images and really like provide good scan times without suffering image quality. So with AirRecon, you have a tool in hand, which I think every technologist dreamed of before, because now finally we can like really maintain perfect scan times and have still good image quality. And then MR, usually what you do have is you have to always compromise, because you cannot have like fast scan times and good image quality. You always have to like make a compromise. But with AirRecon DL, you have tools now in your hand where you can do both.
One thing I'd like to comment too, you'll notice some fine line artifact here on the image on the right. If we zoom up on that a little bit more, you can even see that. So AirRecon DL can help remove some of this Gibbs and truncation artifacts that we've commonly seen in MR historically since the beginning, really. Those artifacts are due to a very stark tissue contrast that signal kind of propagates through the images and then causes those fine line artifacts. So AirRecon DL does a great job on removing those as well.
So the localizer is finished from the cervical spine, and here is the example of how the coils have been selected. So you see in the back of the patient, the P8 posterior part of the head coil, the elements which we will use for the cervical spine imaging will be are highlighted in blue. Then here is the posterior element in the table, and also here the software will pick only a few elements to help with making the images. Here's the anterior part of the head coil, and here already partly the area located on the patient. And the system picks the elements in need, and you don't have to like deselect anything here on the user interface. Also for that scan, we are using AirRecon DL. So here I've selected this Recon DL strength high in this protocol, and we will end up again with a pixel size of 0.7 by 0.9 and 3 millimeter slice thicknesses, and we will have a scan time from only 55 seconds. And then we move our way further down in the body, so I can just run a localizer now in the liver, go all the way with my localizer to the liver scan. There we go even a little bit further down and do the same scan again to understand where the coils are now in that case. And we can have a look at our images we just acquired. So we did higher resolution scan here for the T2 image, and I will just bring that to compare that to the first image. So here we had in-plane resolution of 0.6 millimeter, and here is 0.4. So this is with 3 millimeter slice thicknesses. Here we do have 4 millimeter slice thicknesses. Both will be using AirRecon DL. And I just will give you the entire brain before I zoom in. And as you can see, you see the structures even a little bit sharper here, just because we're having a high resolution images. So now I zoom in a little bit more. So for that scan on the right-hand side, we had a scan time from only 1 minute and 45 seconds. So before we would have, before we had AirRecon DL, I think when we want to have an in-plane resolution as we used here on the right-hand side, I think we would have to have a scan time around maybe 2.5, 3 minutes. So that is how much savings you can have when using AirRecon DL. Okay, and you see we are running here the localizer in the liver, and then we want to show you some free breathing in the liver, and maybe we want to start with a T2 sequence here. So the localizer is done. I will scroll through the images that we can see how much coverage we have, and as you can see, the navigator has been popping out automatically. So again, intelligence on the scanner where the technologists don't have to worry about placement. So we have here the navigator automatically on the diaphragm, because the localizer has a post-processing task implemented, and it will do an auto tracker placement after the localizer has been finished. So again, something where the scanner helps you to perform nice image quality, no matter who is sitting in front of the scanner, which is really, really nice to maintain good image quality. So we will combine in our T2 image the navigator technique to let the patient free breathe all the time. But on top of the free breathing, we will also utilize our propeller technique. So meaning we are using our blade feature to remove even more motion out of the image. So he can breathe entirely free for 3 minutes, and we will generate 2T image with fat suppression here in that scan. And now we have a little bit time to look at our cervical spine images. So remember, the scan time here was 55 seconds, and I want to show you again the comparison between Air Recon DL on the left-hand side and same image without Air Recon DL. So I will just screen and zoom in here a little bit. And you can see that also the sharpness has been improved when using Air Recon DL. It's nice to do these scans in such a short scan times, because we know that is our goal as a technologist, to get the patient in and out of the bore as fast as possible to and still have good image quality. Okay, now we are clicking back on our current scan, and as you can see, the navigator feature is always offering us to have access to the trigger while we are scanning. That is really a feature which you use often in real life, because everybody knows that when you scan an abdomen, that a patient is really excited coming into the bore, is getting nervous. So his breathing is totally different and maybe way faster. And then after a few minutes, you see that the breathing as it is here is maybe decreasing. So what we can do with our navigator is that we can adjust the threshold and really adjust to the patient breathing in real time. So when you see that the breathing pattern change, the threshold is here, the red line, and here you have icons where you can get the threshold changed, and you can go ahead while scanning live and changing the threshold to make sure that you always cover any patient in the bore again. So you don't have to stop the scan and talk to your patient and ask him to breathe in a different way. They can breathe however they feel comfortable, and you can catch their breath. Okay. The next sequence we want to show you is free breathing T1 contrast. That is something really nice too, that we don't have to we don't have to have any extensions with contrast. We can do any contrast you can think of and do that combined with our navigator. So here I want to show you a T1 sequence, and I picked lava flex, meaning it will be a Dixon technique, and we will show you also the in and a post phase image. So it will be a T1 contrast, totally done in free breathing, which helps you a lot thinking about your patient who is not able to breathe anymore, and you have to do a dynamic scan. So you can use that sequence and do real dynamic scans in anterior faces in free breathing. And then we can show you single shot sequences in the abdomen, just to show you how much coverage the air coil gives you. So we can have large field of views here. And we will cover the liver and almost the entire pelvis in just one scan. And here for the single shot, we also will utilize Recon DL. So we have here the Recon DL strength set again to high. So what we will do for that sequence is we will again have really thin slice thicknesses, about 3 millimeter, and show you how the images look with and without Air Recon DL. And just while this is running, a little bit more words about air touch. So here I want to show you that on an example of really less S2I coverage. So again, we have the coils. The anterior AA is in front of the patient. In the back, you see the PA, which is embedded in the table. And then you might see my stack just positioned, and the tool air touch just picked a little amount of the coil elements. So when I move my stack around, you see that I don't have to interact with my coils user interface at all. I just have to, I can position my field of view wherever I want. And you see how interactive and reactive air touch is, and just selects always the right coil elements. So actually, the nice thing is that it really helps you to do mistakes. Even when we scan in-house here since 10, 15 years, it happens so often that when we scan with like multiple coil setups on the patient, that we forgot to turn on coil elements, and then you have a 2 or 3 minute scan, and you see afterwards that the scan is just noise because you forgot to turn on the right coil. So luckily with Air Touch now, I can totally rely on this software, and just let the system do my pick, and it never happens again that I find out that I haven't selected the right coil after 3 minutes. And then we can just go ahead and switch to pelvis and end up in the prostate. So as you can see that we really started in the brain. Now we are ending up in the pelvis with this session, and we both have never left the chair. So that is really huge advantages, and that kind of like also changed my scanning behavior, because I don't like put really the coils I'm 100% sure I'm going to use on the patient anymore. Since we have the air coils and they're in the light design, sometimes I just go ahead and put coils I might need for my scanning session, because I don't have to worry about which parts to select or do. I just put everything, and I'm ready to scan, and the scanner will do the rest for me. So here we have the free breathing liver with propeller. You can see how nicely and less motion the images have. We covered the liver. And as you can see, we cannot tell our volunteers to have not lunch or to have lunch. So that is why they are all coming right from their desk. They are all our co-workers and are volunteering here to be in the board.
See the pancreas, nice on that one.
Mm-hmm. Maybe because we see that so nice, we can just try to do an MRCP here if we want to. So also the MRCP, I can just use a navigator to track it. So we'll just go ahead and look at the pancreas here real quick. And here it is. So I will just prescribe my slices. Put the tracker back on. And then we can do the navigator. And maybe because matter of time, I just want to scan so much of the view, I just go ahead and shrink it down to maybe 60. So again, it will be a free breathing scan. We will do the navigator technique on it. And we will combine, in order to have short scan times, now hypersense with that sequence. So we will end up in a scan time of 2 minutes and 11 seconds, and we will have a slice thickness of 1.2 millimeter here. And then we can look at the next images here as well. Just finished our free breathing T1 sequence, and I want to show you like all of the image impressions we got. Since we scanned Dixon, we do have the water selective image, we do have the fat selective image, we have an in-phase image, and we have a post-phase image.
It's pretty amazing with free breathing.
Yeah.
The navigator looks really great for that.
And that is like just as a reminder without contrast media. So just imagine, since that is a T1 contrast, when we could have injected some contrast media, how much nicer they would look. But nice large coverage, yeah. And we can like combine them really with a dynamic scan. So then the scanner will make sure that it will like do that automatically for an arterial phase, for a venous phase, or for even a late phase. So you can set the protocol up and just let the scanner do the rest for you.
And on the new software too, Lava Flex is compatible with HyperSense.
To make it, yeah.
So you can go even faster with dynamic acquisitions like Lava Flex, Disco Flex, or even in the brain with MP Rage or Bravo 2.
And here, just maybe to end up the session, we can do a last scan quickly in the prostate. As you can see, we still have plenty of coverage here in the pelvis. And our volunteer has a normal height, I would say. He was like not a unusual height. And you can see that we have still coverage with the air echo almost until his mid-highs. So that means you don't have to do anything in regards of like making now a nice prostate scan. You can just resume your scanning. So again, starting in the head, ending in the prostate, and we will do here a Pirates compatible protocol with a 0.4 by 0.7 millimeter slice thicknesses. 3 millimeter is the slice thickness, and then we will end up with a scan time of 3 minutes and 38 seconds. Okay, the MRCP is running now, also in free breathing, and then we do the prostate, and maybe we look in the round if somebody has some questions.
I know we're a few minutes over 1:30, but you guys have time to stick with us just for a few minutes for these to run. Apologies for the late start once again.
I do not see any questions in the chat yet. Feel free to add in the chat, or you can go ahead and speak up, unmute your microphone, and ask a question that way.
And in the meantime, we can review our single shot images, because these are the ones I haven't shown now. So I will show you again the comparison between Air Recon DL and without Air Recon DL. So on the right-hand side, obviously is without Air Recon DL. On the left-hand side is Air Recon DL. So we do have scan time in one breath hold, 20 seconds, and we were scanning 3 millimeter slice thicknesses. And I want to again zoom in here way more, that you can see how sharp and different the image looked like when the noise has been removed. So maybe as a reminder that we have Air Recon DL now implemented in all of our FSE family. So you can scan it anywhere in the body when we look at FSE sequences, no matter which contrast. So we can do T1s, T2, PDs, and fat saturation wherever you want to do inversion recovery for sure as well. And then we can use that in combination with gradient echo-based sequences, but also with single shots. And we are excited in our latest software. We have also Air Recon DL implemented for diffusion techniques, for API diffusion techniques. And
it's available across the entire portfolio too,
yeah.
1.5T and 3T products.
And as I said earlier, I think that is my feature which I'm most excited about, because it allows you to really like do something in MR, and you don't have to like pay for it in regards with scan time, or like you have to compromise on resolution, because you rather want to have like really this resolution, but the scan time would be so long, so you always compromise in MRI. But with Air Recon DL, you are able to really do something which we could never do before. Okay, the MRCP is done, and hopefully we were right that his lunch was good, and we can see the duct perfectly. And then we will do one final scan in the prostate and look at that as well. And that is also another thing which I really appreciate about our latest software is that I can set up the patient entirely with all the coils I can think of. And as you saw, we just started with really high image quality in the brain, and we will ending up in the prostate with even Pirates compatible sequences, and I never have to leave the chair. So that's also like really, really huge that you are now able and be really efficient with air touch, that you don't have to think about your workflow anymore, because you can just combine coils however you want. Okay.
It's pretty good.
Yeah, free breathing in 2 minutes and 11 seconds. Okay. And all the features, that is what Steve said, is we were showing you today are available across our entire portfolio. So it's not that we are only able to show you air touch on our high-end 3T scanners. No, we can do that on all of our scanners, no matter if 3T or 1.5. So every scanner is implemented with air touch, which allows you really to be efficient and fast with a patient scan setup and the coil environment now. Okay.
Well, thanks for sticking with us, guys. Just 2 more minutes, we'll be finished.
Okay.
So tomorrow for the scan sessions, I think we're going to be on SIGNA Artist.
Yes.
Highlighting a few things with workflow, coil overview, things like this. So once again, guys, thanks for your patience today and sticking around with us. I know we're a little bit over time, but it's nice having you guys here with us to see some of these intelligently efficient offerings that we've got. A nice example here of a Recon DL in the pelvis, male pelvis, for PIRADS compatible prostate protocol.
Yeah, done in 3 minutes. And we even started in the brain. So
Way through.
all the way through and ending up with really high resolution prostate images at the end.
All right, that's great. Well, if there's no questions, thank you all for joining. Really appreciate your time today. Thank you.
Thank you so much. Bye.
Thank you.